Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is cryptogenic organising pneumonia. So what is cryptogenic organising pneumonia, or COP? This is also known as BOOP, B-O-O-P, which stands for bronchiolitis obliterans organising pneumonia. This is a form of interstitial lung disease in which bronchioles and alveoli become inflamed, leading to breathlessness and flu-like symptoms. It's most common in people aged in their 50s to 60s, and there is no gender predisposition. The etiology is unknown, but it is associated with various medical conditions, predominantly connective tissue diseases. Other causes include viral, such as HIV, mycoplasma pneumonia, drug toxicity, vasculitides, aspiration, transplantation, and radiation. The pathology of this condition involves fibrous plugging of alveoli and bronchioles. The lung architecture is crucially preserved, so there is no evidence of fibrosis. Signs and symptoms of cryptogenic organising pneumonia include subacute flu-like symptoms, which include fever, malaise, and weight loss. There is a persistent cough and breathlessness, and crackles will be found on examination, although examination of the lungs may be normal. Investigations, in addition to a history and examination and observations, include bloods, which will show raised inflammatory markers and a neutrophilia. Pulmonary function tests will show a restrictive defect with a reduced DLCO. Chest X-ray may show patchy bilateral consolidation, mostly in the lower lobes, and a HRCT scan will show bilateral patchy asymmetric area of consolidation with ground glass opacities, again mainly in the lower zones. An ABG should be performed, which will show a type 1 respiratory failure, and a VATS or wedge biopsy can help in securing the diagnosis. The management of COP involves oral steroids, which are very effective. Specifically, this involves high-dose prednisolone, which should be gradually tapered to zero over several months. The prognosis is excellent in most cases, with many patients improving within 3 months. So let's try a question. A 65-year-old lady with a background of breast cancer treated with chemotherapy and radiotherapy presents to the acute medical take, with a 10-day history of being generally unwell with flu-like symptoms. An arterial blood gas shows type 1 respiratory failure. A chest X-ray shows bilateral patchy consolidative changes at the bases. She is suspected to have cryptogenic organising pneumonia on the respiratory post-take ward round. Given the condition, which of the following is incorrect? So our options are A, treatment with steroids is indicated. Option B, HRCT will show ground glass appearance. C, HRCT will show a mosaic pattern. D, the prognosis is excellent, and E, a VATS is indicated. So the correct answer here is HRCT will show a mosaic pattern, as we would expect the HRCT to show a ground glass appearance. It's also, of course, important to remember in this case that the vignette is giving you the answer for the diagnosis of cryptogenic organising pneumonia. So this assumes that within the vignette, adequate tests have been carried out in order to exclude other diagnoses, because, of course, in real life, this patient would be at very high risk, for example, of chest sepsis, but we've been given the diagnosis in this case, so we're basing the answer on what we have been told the diagnosis is, which is cryptogenic organising pneumonia. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.